Dr. Baylor.
I'm Keelan.
Nice to meet you. I'm going to be assessing you from the base of your head down to about the top of your britches. If I have to expose any skin in that area, would that be okay?
Yes.
Or are you cleared in the clinic to get adjusted?
I am.
Do you have any contraindicating injuries or reasons why you can't be adjusted?
No.
Okay. I need you to move your shirt and sit facing the microwaves for me.
Okay.
Scanner, you there? I need you to sit flat-footed with your palms facing up and sitting right for me. I'm gonna start down here at your sacral base. Okay. Hey, come down. I'm gonna have you lie face down. I'm gonna put your shirt down and cover the bench. There we go. And to support your ankles, I'm gonna place this under your legs. Raise your legs up. And now tuck your britches, please.
Yes.
Sit up, your face toward the microwaves again. I want to assess your thoracics. Could you place your hands behind your back for me, sir? Okay. And now can you cross them for me? We're going to place flexion and extension. Okay. I'm going to rotate you. And depress. Okay. Exercise something. Rotate. Behind your back so I can assess your ribs. Okay. He goes one for me. From about T3, so that bit for 2, 3, okay, rotation, easier to flex. When assessing the SI joint for posterior glide, my segmental contact point was the SI joint and the patient's ASIS. My line of drive, anterior to posterior. When assessing the SI joint for posterior glide, my segmental contact point was the SI joint and the patient's knee, and my line of drive was posterior to anterior. When assessing the SI joint for internal rotation, my segmental contact point was the SI joint in the patient's ankle, where my line of drive was lateral to medial. When assessing the SI joint for external rotation, my segmental contact point was the SI joint in the patient's ankle, while my line of drive was medial to lateral. When assessing the thorax region, for flexion and extension, my segmental contact point was the interspinal space, and my line of drive was posteriorly to anterior. When assessing rotation of the thorax region, my segmental contact point was the lateral aspect of the spinous process. My line of drive was posterior to anterior, lateral to medial. When assessing lateral bending of the thorax region, my segmental contact point was the lateral aspect of the spinous process. My line of drive, lateral to medial, inferior to superior. When assessing the rib pairs for depression, my segmental contact point was the superior border of the rib. My line of drive was superior to inferior. When assessing the rib for elevation, my segmental contact point was the inferior border of the rib, and my line of drive, inferior to superior. When assessing the cervical region, for flexion and extension, my segmental contact point was the interspinal spaces. For my line of drive, it was P to A. And for rotation, my segmental contact point was the articular pillars. My line of drive, lateral to medial. When assessing lateral bending of the cervical region, my segmental contact point was the articular pillars, and my line of drive, lateral to medial.